Now to Aetna and Humana. You remember yesterday they announced that huge $37 billion deal. Well, you know what? It's great for them, but really, I mean, is it going to mean more choices for us? Of course not. Less choices for American consumers. So I talked to both CEOs. I took them to task on this program yesterday morning, and now joining us is the author of Beating Obamacare, Betsy McCoy. And Betsy, I've got a few clips for you, okay? I want to run a few, and I want to get your response to each. And we've got to talk about the main one. The idea that these guys said that the cost curve has been going down for 5 years. Check this out. When will we see the cost curve bend or slow down?
We've already started to see it over the last 5 years.
Okay.
And what we want to do is continue that.
It's just unbelievable.
Baloney.
Yeah.
Let me give you the facts. In 2009, healthcare spending increased 3.9%, lowest in 50 years. 2010, the same figure. The administration's own actuaries project that in this decade, under Obamacare, it will increase 6.1% a year, almost double the rate before Obamacare was passed.
I mean, and that's significantly above inflation, significantly above wage growth, significantly above every sort of other economic metric that might even help the average consumer keep up.
And when you listen to the weasel words from these two CEOs, they were saying, well, insurers take a fixed payment per patient. We want doctors and nurses and hospitals to do the same.
That. Let's run that for the audience in case they missed it yesterday. On changing their business model, listen to what they had to say.
The business relationship has to change. Under the old model, regulating insurance doesn't solve the cost problem. And so right now in the healthcare system, physicians work on a cash basis, hospitals work on a revenue basis, and insurers work on a margin basis. Until everybody's on a margin basis, which says when you do good things, margin appears, like it does in Medicare Advantage, fixed pricing. Nothing will change.
No, one before you answer. Did you see the smile? Did you see the smile on the CEO from Humana?
What a party line! They want to make your doctor into an insurance company. They want to shift the risk and still get paid, and your doctor has to accept a fixed payment and then provide whatever you need. Well, that destroys the trust between you and your doctor, because whatever your doctor prescribes for you, any x-rays, any other tests, any treatments come out of your own doctor's own pocket at the end of the year. It sets up that conflict of interest between the person you need to trust and you.
Well, they also talked a lot about local competition, which really I was so confused about. And then there's also this partnership thing. So it's the last one. We got to roll this one, too.
It's no longer about how much do I pay you for each service.
I can't hear
It's more about how do we create a partnership where you get rewarded for improving the health of the population, and we provide the backstop from a financing standpoint.
All right. The backstop, financing standpoint. I mean, everything was roses with these guys, and yet premiums are going through the roof. Deductibles are going through the roof.
And they're going up way more. Let me explain why.
And that's why, even, by the way, Betsy, and even people who are getting their premiums covered, like 97%, still don't go to the doctor because they can't afford the deductible.
And by the way, when consumers get that subsidy to protect them from the rising premiums, it's the taxpayers who get clobbered. They're still paying that higher premium. They're subsidizing the cost.
Sure. But the president came out with some advice. Here's his advice on a trip to Tennessee. He said that consumers should put pressure on state insurance regulators to scrutinize proposed rate increases, and that way the rate increases will come down. And the HHS secretary said you can shop for a better plan and a cheaper plan. The exchanges are up and running. So the message is you're on your own.
That's fairyland. And the fact is, remember that every time you change plans, you have to change your doctors, because these plans offer a very limited selection of doctors. So what about the president's promise? If you like your doctor, you can keep your doctor. That's history.
All we can say, Betsy, is we're glad that you carry this thing around, and we're glad you're the one in America who read that bad boy. Betsy McCoy, thanks a lot.